This is Trinbago Diaspora Outreach Network, and we are coming to you on our YouTube channel. And of course, there are other social media handles that we are using for our program. So what is happening is we had a first run of Trinbago Diaspora Vignettes last week, and that program featured somebody out of Ottawa. Whom are we talking about? We are talking about the Trinbagonians who have been doing tremendous work in the international arena to benefit the people of Trinidad and Tobago. And you know, Trinbago Diaspora Outreach has a focus on research, recognition, and engagement. So when we speak to the people who best represent that, we share that with you on our program. So today, I have the opportunity to speak with a distinguished internist, Dr. Reynold Agard, who is the head of HANDS International, an organization based out of Loma Linda, but of course, it has a lot of medical experts and others from all over the USA. And why I be talking with this good man today? Because Dr. Reynold Agard, Tobago-born, Trinidad-bred, is the head of a medical mission that is coming into Trinidad and Tobago from July 21st to the 24th. But before we talk about today and what is coming up, let's get a background of this distinguished person, Dr. Reynold Agard. Hi, Dr. Reynold Agard. Welcome to TDON's Vignettes program. Um, Tell me a little bit about your actual occupational field. You are a doctor. And where did you start your practice? Because I sense that you've been moving around. And where are you currently based now?
I trained at Penn State College of Medicine in Pennsylvania. I did my residency at Christiana Care, and after residency, I stayed on there to work as a hospitalist, as one of the physicians or the attendants in the hospital. I did that for 5 years, and God blessed me that I was able to buy my first practice. And 1 year later, I bought another practice, which is currently the practice that I attend. It's at the University of Delaware compound just on the outskirts. And so I also not only treat patients, but I love academics in medicine. So I train a lot of doctors, nurse practitioners, young medical students. They do training with me. I have doctors that have come as far as India to do some training with me. Because, you know, the group of doctors that we have now, we are trying to really let people understand that, you know, as I tell my students, I said, you know, a patient doesn't care how much you know until they know how much you care. And that's really the gist of what we do, caring people. That's what it's about. Mahatma Gandhi, which most people know, very famous. There's a saying that he has, that the best way to find oneself is to lose oneself in the service of others. So that's why I've dedicated my life, my time, my family. You know, we have been in this, and we have traveled across the globe, literally across the globe. Last year I was in 4 different continents. You know, I was in Papua New Guinea, did a mission there. I was in Kenya in November. We were in Australia. We were in India. So I do lots of medical mission across the globe.
Okay, so tell me about HANDS International, how that got started, and give us a sense of what HANDS International looks like in terms of its operational rollout.
So HANDS International is an organization that was started approximately 17 years ago when there was a major hurricane in the Eastern Caribbean islands. And so this group of professional, not just physicians, but accountants, lawyers, based in California, Loma Linda to be specific, they come together and form the group HANDS International. And I joined this group approximately 3 to 4 months after they were formed. And I've been very active. And 14 years ago, I became their president, and I've been the president since then. So we have done medical missions across the globe. We have done lots in Africa, including Nigeria, Kenya, Ghana. We did India several times. We did several Caribbean islands, including Belize, Jamaica, St. Lucia, Grenada, Trinidad and Tobago, as I mentioned before. And whenever there's a disaster, we spearhead disaster. We are known for disaster relief. Actually, during that first earthquake in Haiti, where over 200,000 people died, we took our medical team to Haiti, and we were fortunate to, because through my wife and her skills of getting things done, we were able to have the Dominican Republic government help us to navigate to get to the city of Jacmel in Haiti, because a lot of us know that when the earthquake had destroyed Port-au-Prince, the quagmire that was there, no one could get in, but we were able to fly to Dominican Republic, and the Dominican Republic government, they took us by bus for like 8 hours over the mountain, and it took us, we rode on the back of a Navy ship with all our supplies to get to the city of Jacmel. So we were the first medical team there. So all the search and rescue came to us. One thing that we are famous for is that when we got there that day, the hospital crumbled, and also we had saved a baby that was 26-day-old baby that was really in terrible shape. And my guys, because we have a group of all kind of doctors, including pediatrician, critical care doctors, and they were able to save that baby. And they flew the baby by helicopter out to the U.S. Comfort, which is a U.S.-based hospital ship that goes wherever there's disaster. And that baby is alive today. So we have done it. It was featured. The baby was featured on CNN. So when there's disaster, we've done that. We've went back to Haiti also for that last earthquake. Actually, that earthquake in Lakai, my group was one of the last group of doctors to leave the area when they started kidnapping. We were able to get a raggedy plane to take us. Actually, I still have all my equipments in Haiti because we had to leave there on an urgent basis. So we have seen some terrible situation. Actually, I was interviewed once by CBS National News. They came to my office and they asked me, why would you want to go into these places? Why are we trying not to put our staff and or workers into dangerous situation? But sometimes it calls when you just can't see people suffering and knowing that you have a skill set that you could help. So I turned to them and told them that when your passion exceeds your fear, then you're going to respond so that you could help humanity. So again, that's what drives us. We are people that are passionate about what we do. Hands International, we have doctors from all disciplines. So we have cardiologists, pulmonologists, we have critical care doctors, we have general surgeons, orthopedics, we have ophthalmologists, we have dentists, we have strong mental health group, and a wide variety of disciplines that we will be bringing to Trinidad. One of the also what makes Trinidad unique on this mission is that we also really try to look at the social aspects. So we normally would bring clothes and food and give away. This time we'll be having lots of clothing to give away, food to give away, but also have some barbers that would be there to give free haircuts. We always take a lot of soccer balls to give away and other items, personal hygiene items, toothbrushes, toothpaste cases. So, we want to be very comprehensive in our outreach. We'd also be having lawyers that will be given free legal advice. We have financial advisor that will be given free financial advices. So again, very, very comprehensive program. We hopefully that we can make an impact on the people of Trinidad and Tobago and meet the needs wherever they are needed.
Well, you certainly would make a lot of impact with all those segments of the human condition that you made reference to. But the important question on the back of all of you've been doing around the world, how do you generate money to make these missions possible?
My wife says she should answer that question, but what we've done because every one of our volunteers pay their own way. And not only that, it's a sacrifice because even for me with private practice, a lot of us have private practices. So we know with private practice, if you're not there, money is not generated. So we have had people of like minds. I reach out to my colleagues and they make donations. In Trinidad, we have established Hands International Caribbean so that people can donate not just of their time, but if people want to donate. And some of the business community, we have a local group on the ground, which I'll share his information, that are helping us with some of the logistics here. Like getting tents, getting food, because one of the things that we have also done that's unique to a mission, in Africa especially, a lot of times when you go to these places, some people have never seen a doctor in their entire life. So they would take the chance and they would travel for days and they would line up 3, 4 days before the mission is there. And they're hungry, they have no money, nothing. So we have, when we did our first mission in Nigeria, some of us would not even eat because it's really our hearts are just touched to see that our team stopped to eat lunch and these people standing in line for days and didn't have anything to eat. So a lot of us would just give away our food. So we have pledged that anywhere we go, anyone that walks into that camp must have a meal. So we have done that. We are planning to do that on this mission. And again, we depend on the generosity and any donation that we get. 100% goes to the mission. We don't have people that take any administrative cost, money for the work that they do. They're all volunteers. So we have colleagues, we have friends, we have families that are very generous in giving us donations. So again, if you, through your organization, if you spread the word and they can share, if there's someone out there that is willing to help, that's what we do. The more we get, the more we give. And, hopefully that this could be a forum where that could be spread also.
So is 4 days of significant surgical and other types of medical interactions from July 21st to July 24th. 4 solid days.
Yes.
And what is the size of the team so far confirmed to come into Trinidad from Hands International?
So right now we have approximately 100 people coming. We were like 125, 130 strong, but many of you know what's happening across the globe now, especially in America with the issue with immigrants and visas. So we have quite a few. We're a very diverse group of people. Lots of our doctors are from Pakistan, India, lots from the United States. But there's some people, there's some Trinidad doctors, and some of them have a green card. And a lot of them, their lawyers are telling them, don't take the risks to travel. So we have lost some key people. And as a result, we are down to like 100 people. But we have also engaged the local community of doctors and specialists here. And quite a few of them, we have close to 20 or 25 of them that will be joining us as part of our team, so that there is no lag. We can give the full spectrum of help that we desire.
Well, this is absolutely remarkable. And be sure to know that one of those days, Trinbago Diaspora Outreach Network will be there to cover some of what you're doing and even have some bites from you and others of the team. But this is a phenomenal exercise. We are happy to have this discussion with you and understand the level of input you've been making in Trinidad and Tobago, not just now, but as you say, you had a previous mission to Sandy Grande, a previous one to Point Fortin, and that is certainly, this is the biggest one from what you've said before, that is going to be in Trinidad and Tobago. And there's a likelihood that you may be probably seeing thousands of people over that period of time.
Oh, yes, we have right now close to 8,000 people registered. And but the registration mainly for the surgical procedures. the response has been so overwhelming because it caused us to break up the trip into two different events. So right now we are doing the eye surgery, the cataract surgery. We have rescheduled that a month later for August 20th to the 27th. We are hoping that we could do over 2,000 cataract surgery on that trip. Where we are at the hospital, there are two ORs, and we have really good skilled surgeons, and these guys are willing to work from night and day. Would be able to utilize the two ORs because we have orthopedic surgeons, we have GI surgeons, we have general surgeons. So we'll be doing things like hernias, we'll be doing fibroids, thyroid problems. So there's a lot of orthopedic surgery. We will be doing those. So we don't have to utilize one of the OR for cataract surgery. And so it's a blessing that we're able to shift that. We were able to get the team to shift it to August 20th to the 27th. Around that time, we're going to be sharing more information as we seal down the date. But it's definitely in that week. We would try to come on the Tuesday, work Wednesday, Thursday, Friday. A lot of us are Seventh-day Adventists, so we go to church on Sabbath, and then we work Sunday, Monday, Tuesday. Give like a full 7 days of work.
Okay. I want to thank you so much again, Dr. Reynold Agard, for your tremendous philanthropic zeal, not only for Trinidad and Tobago, but as a Trinbagonian, leading teams going into other countries that are impacted by a lack of significant medical care. So we are very, very grateful. We are proud of you and certainly look forward to being on the ground on the day we start the whole program in July 21st to the 24th. So thank you so much again for sharing, and we will continue to be monitoring your arrangements for that great week in TNT. Much obliged.
Thank you for the opportunity again, and God bless your program and the skill that you have to give information regarding what others are doing, and I adore and applaud you for that, what you do. God bless you.
God bless you too. Thank you very much. So this has been Trinbago Diaspora Vignettes Part 2, and continue to look at our channel for future programs as we spotlight all these vignettes to address what is going on. Remember, it is leading up to Homecoming 2025 from October 17th to October 19th, when we would be also honoring diaspora patriots for philanthropy, cultural promotion, and entrepreneurship in the homeland. So stay tuned for the next episode.